Welcome to the Strength Lab podcast. I am your host, Tyler Ramsey, and my guest today is Dr. Josh Johnson. He is the owner of Johnson Family Chiropractic. He's a fitness enthusiast and a strongman competitor. Thank you, Josh, for being on.
Thank you for having me.
I'd like to mention our two sponsors for the podcast. We have Titan Nutrition. They are a small supplement company with high quality protein and pre workout supplements. If you want to take a look at them, you can look at titannutrition.net and use code Ramsey Strength for 20% off. Also, we have Cerberus Strength USA, the world's strongest training supports and accessories. You can use Ramsey 10 at checkout for 10% off your order. So, Josh, what is chiropractic care?
Well, man, there's a lot of layers to that one. The root of the word chiro refers to hand, and then practic, referring to the practice of using that. So originally a hand-oriented health thing. And most people are familiar with adjustments in general. Like you see all these kind of social media things where people are putting microphones underneath and you hear their neck or back pop or make all this kinds of noise and things like that are popular these days. There's a little bit more to it than the noise. And
Yeah.
chiropractic originally started with a guy who was talking with a janitor in the building. He was working on stuff, and the guy had found himself in a cramped position, and then had become deaf after he felt something kind of pop in that cramped position. And so D.D. Palmer, knowing his knowledge of anatomy and using the bony levers that are there in the spine, if you look at it, you've got like the little tips and the different things that stick off. Like if you look at dinosaur bones, they got like little things that stick up.
Yeah.
We have kind of those too. They just don't stick up out of our skin. But using those kind of levers to adjust it, and then one crazy thing happened is his hearing got better. So that's kind of where chiropractic started. But the idea of restoring motion and alignment to the joints and the bones of the body to allow things to just work how they really are supposed to be doing anyways.
Yeah.
And that's kind of the shortest answer that I think I can give on that one.
Yeah. So what is the philosophy behind chiropractic treatment? Like where did you go to school, and then like where did
Hmm.
you do all of your advanced work at?
Gotcha. So that's like four or five different questions all in one. Let's go with background and then I'll hit
Yeah. Perfect.
philosophy. So I got my bachelor's in human biology, and the doctorate was in chiropractic, and that was at Logan College in St. Louis. There are several other chiropractic-oriented colleges in the country, but I went there, and they did a really good job at the sciences and the educational components to be able to get your to pass your board exams and to do well in that one. They have a really high success rate on that. I did some additional training in office in Florida that dealt with intensive care for scoliosis,
Okay.
so chiropractic and other rehab stuff to deal with kind of the extreme cases where people would fly in for a week or 2 weeks for their intensive care program to do what's called structural correction. Like for example, if you have curves in the spine, the idea is to straighten them out measurably on post X-ray. And so that corrective component's a lot of my additional training before opening up my own practice here in 2010. Philosophy of chiropractic, there's a couple of schools of thought in the way that people think whenever they're adjusting. There's kind of the biomechanical thinking, where you want things to be aligned and moving well,
Yep.
just for balance and mechanical wear and tear and things like that, which is absolutely a legitimate vein of thinking. The other side is more recognition of the body's ability to heal itself. And if you think about it, if you were to cut your hand, it should just heal unless there's some other reason it can't do that.
That's fair. Yep.
So so we know that the body's made to heal itself. It's just kind of a question of if we have a problem, why is it not doing that? And so that's where the chiropractic philosophy is looking at the spine for its imbalances, lack of motion, misalignments, to look for things that can interfere with how the body's naturally supposed to function at its best. And then there's a lot of techniques as to how
Yeah.
to go about addressing that.
Yeah. So what should somebody expect during their first visit? Do they come in and get cracked right away, or is there like a process that you like to follow before you
I
do
like
it,
to be a
before
little
you
bit
touch
more,
anybody, before you touch
yeah,
any spots?
right. I like to be a little more technical on that one. You may walk into an office office and they half look at you and just start popping things. But I'd rather actually do an exam. May sound silly. Like intake a questionnaire, look at your history. What's going on? Why are you here? Let's look at your posture. Let's check range of motion. Let's take some x-rays if we need to do that. And then have a chance to kind of reflect on all of this information, make sure I'm not missing anything, and look over everything well. And then we can see about testing to see how you'd respond to something. Usually that's on a second visit to give me plenty of time to look at it. Um, that way I can make a more educated decision on you as a unique individual, what you need, and
Yeah.
then we can test that out to see what works.
Yeah. Cause not everybody's the same. They're not all expecting, they all got different issues going on. So
Oh yeah.
you can't just go in and do what you normally do. You have to look at things, examine, and then, there's different treatments for the same
Mhm.
thing, but, just finding a way to relieve their pain.
Yeah, I mean, in the same way as training, even if somebody has similar goals, where they're at in that process, it can be wildly different.
Yeah.
Their age can be a factor, how overweight they are can be a factor, other health things can be a factor. All that's going to change how you go about it.
Yeah. So the next question is going to help direct us towards the chiropractic care and strength training. Can chiropractors help
Mhm.
with athletic injuries and performance?
Yeah, absolutely. There's a variety of things you can do on the injury side and assessment to figure out what's going on. A lot of times in my experience in the acute phase of things, like when I was back when CrossFit did the regionals, they did that in Chicago. I was on part of the team there. And I was part of the chiropractic team. They also had other help and physical therapists and a variety of other different resources there is available. And so there was kind of this triage of injury, and then there's more of the focus on the biomechanics and performance.
Yeah.
And so we were typically more on the biomechanics and performance side of things. But often in private practice, like where I'm at now, a lot of times that initial encounter is because something went wrong, because something's painful, not, hey, I'm a little bit stiff here, something really mild, or hey, can you find anything that might inhibit my performance? Like I'd rather be in that space, but most people come in because, something busted that started 20 years ago and they've been ignoring it.
Yeah. I know a lot. You do a lot with some of the people on Strongman Saturday that we have. They got
Yes.
some shoulder things, some back things, and you're in the
hmm
middle of your workout, you're always, hands on trying to have them do certain things. So I've seen that firsthand. So,
Yeah.
what are the most
So a
common
little bit of
missile?
firsthand triage there.
You're the first hand triage when we need something. What are the most common misalignments you see in strength athletes, and then how does that affect performance? So let's maybe go like if one of them's lower back and shoulders. Let's kind of
hmm
what do you
Those are
see?
super common, and a lot of it really depends on what movements you're doing. Like strongman strength is going to be radically different because it's a whole lot of posterior chain oriented work, more so than even powerlifting, which is still has a whole lot of that. You're going to deal more with knees and shoulders and wrists and all of those things. More so in the powerlift side. You've got general like bodybuilding side of things, which is going to look a little bit different. So there's really a lot of different answers there, but let's start with the lower back because that's the most common
Yeah,
that people are familiar with. A lot of the biomechanics of that go back to either how you're lifting or sometimes pushing yourself too hard for what you're capable of at that moment. And typically, how those things start. So if you're either doing more volume than you've got the endurance for or heavier than you've got the training for, then you lose your position. And then altered mechanics are really what are most likely to prevent or to create injuries and problems. And it's not always the big lift. Most of the time when I deal with people, it's not because they deadlifted and they got hurt. It's because they sat on the couch weird for 4 hours watching a movie and now they can't get up.
yeah,
Even if they did strongman stuff before then, it's usually the couch that does them in.
yeah,
Is that timing? Because if you think about it, when you're warmed up, you're focusing on your form, you're going to be doing things well. It's not the training that's more risky. It's the random other crap in life when you're not paying attention.
Yeah,
Like things are loosened up, they're warm, you sit down, you get cold, your body molds to the shape of whatever support you don't have on your couch or recliner or whatever. And then when you try and get up, all of a sudden the body freaks out because it's now cold in a funky position, whereas you sat down just trying to chill after your workout, as one example.
so what do you think of the people that like, let's say you post a video on Facebook and someone says, "Oh, that makes my back hurt." How does that comment like make
Uh,
you, or what does that make you think of?
okay. Are you talking about lifting and then their back hurts? Like, I can't deadlift because my back hurts kind of a thing?
Yeah.
Well, honestly, it usually means that either you have a problem you've ignored or you're doing it wrong. Like deadlifts inherently are not a bad thing for the spine. It's incredibly engaging for your core and so many other things. Now, you might not hear that from other physical therapists, orthopedics, doctors. They tend to be like, lifting is bad, sort of a mentality.
Yeah.
But the reality is, functional strength and capacity is so much more saving of injury than it is causing. So that's a clue. It's kind of a red flag. Hey, form's off, or you already have an underlying issue that you haven't addressed yet.
Yeah, that's why I wanted you on the podcast, because you work with you work with people, but you also do the strength training yourself. So you have that correlation between both.
Mhm. It's helpful to have some firsthand knowledge of these things
Yeah.
because half the time you go to a doctor and you mention a word, or like I was doing a log press and they're like, did you have a chainsaw or something? What are you doing? Are you a lumberjack? I don't understand. And they really just have no idea the mechanics of what's going on.
Yeah.
So it's really helpful for that if you're working with a particular sport to have a familiarity with what that sport looks like in training and in practice is hugely helpful for that athlete.
Yeah. So let's talk about spinal adjustments. Can they lead to strength increases, or is it more of a mobility and function aspect?
Honestly, there's two different veins in that one because if you think about the neurologic side of it, which would be kind of one category, you can effectively turn the power on to muscles that have a reduced capacity, which is extremely common. You can, like, for example, there are muscle strength tests for nerve injuries, which are more the extreme example. And if your functional test of that muscle is weak in a particular nerve root, that's usually an indication of a neurologic deficit at that nerve root level. Like you have a disc issue at C5 in your neck that's going to affect your bicep muscle. So things of that nature on the more acute extreme example. But from a functional standpoint, you may be about 80% of your capacity in a certain area. You can turn that power back on, removing the interference from the biomechanics and the neuro input, and literally have an almost immediate strength gain while that's now more optimally functional. And then out of that, that's the neurologic piece, which I can get a little more sciencey if you want to go down that route.
Yeah, I'd like you to explain a little bit of that.
Okay. Let's get at it. On the recovery side of things, that's primarily the parasympathetic side of that's your rest, digest, heal, recovery. It's kind of the opposite of anxiety, fight or flight, stress, those types of things. Your sympathetic nervous system is kind of the one where you'll hear about grandma lifting a car off their child type of a situation where their adrenaline is cranked. They can go do the performance. They may break their spine, but they're able to get it done to save. That's the sympathetic side of the nervous system. The parasympathetic side is rest, digest, heal, and recovery. And so it's highly stimulated by what's called mechanoreception. And that essentially your body has sensors like your car does, whether you have sensors for your tire pressure, your oil pressure, your air fuel ratio, whatever. You have those sensors that tell the computer, hey, what's going on out here. And so mechanoreceptors are the receptors for movement into your neurologic system. And so we need to have a baseline level of input in order for homeostasis and functional balance of inflammation and healing and recovery neurologically. And so if you lose that movement, through something as simple as a joint getting stiff, now all of a sudden you have these inflammatory cytokine cascades like substance P and glutamate that cause more inflammation in an area, versus when you increase that mechanoreceptive input, that motion into certain areas, now you all of a sudden you get this release of GABA, which is the calming neurotransmitter, primarily the parasympathetic nervous system. And so that helps with that recovery component. So you've got the inflammatory side that we typically associate with pain and injury, and we've got the anti-inflammatory side we end up with on the recovery piece. And so simply getting joints that are stuck moving can amplify that recovery capacity and stop that neurologic deficit effectively.
Do you think there's any type of supplements or anything that helps with inflammation that you like recommend for people if
Oh
they're
my gosh, yeah.
struggling?
There's a litany of those guys. The on inflammation itself, well, some of the first go-tos are going to be your fish oils, your omega-3s, because your inflammatory profile, you can actually do blood testing or blood spot fatty acid analysis and look at your 3, 6, and 9 ratios. Your sixes are going to be more inflammatory. Your threes are going to be more anti-inflammatory. Little side thought on inflammation, that's a normal process of healing.
Yeah.
The problem is that most of us are way out of balance in how we react to it, because most of us, instead of being at about a 2 to 1, 4 to 1 omega 6 to 3 ratio inside our body, we're typically something like 20 to 1, way, way, way too inflammatory as a reactivity. So when we have something going on, it blows up rather than just simply healing. So omegas are great, turmeric is great. There's a list of others on the inflammatory side. On the GABA neurotransmitter, you can actually take that as a supplement.
Oh, okay.
You can supplement GABA. You can support GABA production with an L-theanine is another one that would tends to promote its release. And then, of course, there's a lot of ways to mechanically stimulate the parasympathetic nervous system between humming, singing, deep diaphragmatic breathing, lots of things that you can do there.
So what's the difference between chiropractic and physical therapy?
There's a good chunk of differences there. One, there's going to be a little bit of difference in the style of philosophy of training. Physical therapy's just recently moved over to a doctorate structure as opposed to used to be more of a master's program, whereas chiropractic's been a doctorate program for a long time. But physical therapy primarily is gonna step into places that a lot of chiropractic does not. For example, your post-surgery rehab types of things, or post automobile accident type of trauma rehab. Let's say your bones are broken, and then now you need to rebuild things at a very minute level. Physical therapy can do some wonderful things in the rehab, and they're primarily going to be focusing on movement from a soft tissue vantage point primarily. Whereas chiropractic started off looking primarily at the joints and the bones and their motion and alignment, and less on the soft tissue. And so when you start dealing with some level of either immobilization on the physical therapy side, which is kind of like tiptoeing into the chiropractic world, or in the chiropractic world, focusing on strengthening, stretching, and rehabbing things, touches on the physical therapy side. For example, in the National Boards for Chiropractic, there is a physical therapy section that's required to pass as well. So there's a good chunk of training in that world as well. So when you put the two types of ideologies together, you've got the joints, motion, and alignment addressed. You've got the soft tissue side of things addressed. And in most situations, you're going to benefit from a blend of the two because they're attached. Whether that be done in the chiro office and do both of them, or whether that be a PT chiro combo.
How do you help
Does that make sense?
athletes dealing with chronic lower back pain? Is there certain exercises you would like them to
To be doing.
try, and or is there
Hmm.
ones you like to have them stay away from?
Um, with chronic is going to be a little bit different than the acute injury side of things. The acute injury, you think about like your low back disc. And usually there's going to be some specific things you want to avoid. Typically, bending forward or twisting are going to be more of an irritant to the acute side of a disc issue. So if you flex forward, you put pressure on that disc, it's going to get swollen, mad, bulge more, push on the nerve, all of that. And the annular fibers of the disc run crosswise, so when you twist, you load that as well. So doing your Russian twist type ab stuff or standard sit up or crunch type things are going to put more pressure in that acute side of the lower back injury. A lot of chronic stuff is going to be a bit more complex because it depends on the individual situation. But typically speaking, more the chronic situations are going to be dealing with more the degeneration side of the joint and disc, which is not as acutely inflamed typically, but they're going to be dealing with that stiffness, the scar tissue, and the generalized compression of the disc and joint height. And so with that, you want to work on your X, Y, and Z axis of all the motions. So you want to be able to move things forward, back, side to side, rotate. But the other part is the Y axis vertical. It's kind of anti-gravity direction that often gets missed
Yeah.
to open things up. Like you may have heard of decompression,
Yep.
for example. That's a Y-axis type of motion where most of the time, due to just gravity, everything gets compressed over time, especially in joints that don't have that motion. So as a child, you have direct blood supply to your growth plates, which feeds your discs and joints. When you stop growing, you lose that. The only way to keep your joints moving and hydrated as an adult is with that motion itself. That motion creates the circulation. And when you lose that, joints dehydrate, and then over time they'll degenerate. But you typically won't see that on an X-ray until about 10 years or later.
Okay. So for people that are listening, they heard you say, you know, no twisting, no Russian twists and stuff like that. They may take that as like he said not to do those things. Are you saying that those things are bad to do if your back is healthy, or are they okay to do if your back is fine?
Oh, gotcha. Yeah, great question. And people get confused about that all the time. Those are great exercises when you don't have an injury because you need to activate your muscles and you need to be able to rotate. That's a normal physiologic range of motion. You need to be able to load your lower back. If you're ever going to be able to pick something up off the ground or stand up or hold your kids or carry your groceries, you need that lower back to have some
For
strength.
sure.
You need your core activated. Those are all things that are absolutely beneficial in virtually every capacity of life. But in the short duration with an acute disc injury, those are the most commons to keep poking the bear, making the problem worse.
What are some early signs of spinal misalignment that people should watch out for?
Well, that might be tough to answer because there usually aren't early signs to them or something.
Okay.
Usually early signs are silent because you really don't know. Because you can have global range of motion just fine for a long time, but you may have one segment that's just a little bit stiff or not moving or was aggravated by something. Maybe it hurt over a weekend and didn't hurt anymore. So the idea is, hey, it's fine. On the early stages, the really the best way to know what's going on is to actually evaluate it, to check the segmental motion alignment, if X-rays if need be. That's going to be more accurate. Now, later stages, when they start showing up, that's typically when you have the symptoms that you can start paying attention to. It's kind of like the iceberg underneath the water, and then the tip pokes up.
Yep.
The tip that pokes up is kind of when you can start paying attention to your symptoms. But that doesn't necessarily mean you don't have this whole thing underneath that's been brewing silently for a long period of time in many cases. But stiffness in general is probably the first one that you can notice, but most people don't think is a big deal.
So do you think people should start
Beyond
seeing
that,
the Oh, go ahead.
no, you can go ahead. Like that's a great question. Should people start seeing a chiropractor before pain?
Yeah. Yeah.
Is that essentially what you're asking? Yeah,
Yeah.
honestly, I highly recommend that. And if you think about it, not that different than having your teeth checked to see if you have a cavity before it starts hurting and feeling like you're about to die. Like most people realize that children should have their teeth checked, make sure everything's growing okay and developing okay, make sure you don't have cavities, and if you do have a cavity, you address it. It's the same thing with spinal misalignments or the term being subluxation. That's kind of the same thing in dentistry as a cavity. You have this problem that sometimes hurts, sometimes doesn't, but it is a problem that will affect that area. So yeah, checking those things. I take care of babies as, as soon as they're on the outside, because the birth process can be pretty traumatic. Ask any mom. It's a rough go. But yeah, you can check little ones as soon as they're out. And oftentimes it's very, very gentle, very, very subtle to move much of anything. Like you'll see videos of people almost body slamming some athlete to try and get an adjustment to happen. Like it takes some force on these big guys. But with a baby, it can be as little as a slight finger vibration on their atlas, that top bone in their neck, and then it just gently, it almost feels like it melts. It just slides back over. Range of motion gets back. Simple things right in through there. And then of course you can check kids. I mean, the average kid falls like 2,000 times a year or something like that. I forget the exact number, but it's absurd the many times that we do something
Yeah.
growing up, especially guys or athletes in general. So the likelihood of getting to adulthood without some sort of problem is pretty darn low.
Yeah. Doesn't sound likely after just talking with you for
Not
20
really.
minutes. It's like the body goes through a bunch of hell. So,
Pretty much. It's
yeah.
like amazing, especially guys with all the dumb stuff we do. It's amazing we even survive to adulthood, let alone are functional.
That's fair. That's fair.
Like how many times we jump off a roof or do something stupid. Um, that's just the nature of it. But yeah, we develop all kinds of little things, so it's most advantageous to find things earlier, and smaller problems are easier to address than larger problems than the average, I don't know, 45-year-old guy who comes in with arthritis that began 20 years ago, he just didn't know about until this weekend.
Yeah. What are some daily movement habits that, strength athletes or just anyday people should adopt to maintain spinal health? Is there anything they can do on their own if they go to a gym? Is there things that they could do
They can do.
to help?
Oh, absolutely. There's a lot of things that you can do. General range of motion are going to be hugely helpful. You can think about it if you want to get back into like into algebra, everybody's favorite subject, the
Ooh,
the X, Y, and Z axis conversation. So when you're moving the body forward and backward, think about the spine in particular. I'd forgotten to mention earlier that the densest population of mechanoreceptors in your entire body are along the spine. So your spinal motion is going to be more deeply integrated with that anti-inflammatory and recovery mechanism neurologically than any other area of your body. So spinal motion, or let's call it spinal hygiene. Like you would brush and floss your teeth, you would wash your hands, your spine should move. And so spinal hygiene, have you ever seen the little wobble discs they have in kids' classrooms anymore so they can like fidget?
yeah.
Yeah, it's just like a balance disc type of things. We have those in the office, and I believe you've seen them there too. But
Yep.
the idea is that you can move your hips a little further. You can just kind of bend your spine to the side, left and right, kind of like the letter C, front to back, again, the same mentality like the letter C, and then rotate. So just moving in those general motions, you can do it upright, or in yoga, you'll do things like the cat cow, where you arch up and down, where you're just doing it when your body's in a horizontal position. But the same mentality, you're getting everything to stretch and move. And it's that motion that's the first that most people tend to lose. So if you can get that motion going, that's hugely helpful. And then there's a million stretches that you could do, depending on where you're tight. And that's where somebody like yourself or a trainer or whoever is going to be able to see, hey, that area is not moving. Let's do these things before you get going.
Yeah.
That outside eye on your situation is hugely valuable. As an athlete, even with my background and knowledge, I'll do a particular movement, and then somebody will tell me something, or I go back and look at a video, and I'm completely surprised by what actually happened versus what in my own head I thought happened. So that outside eye is game changer to have that coaching on that side of things. Same thing with your health.
Yeah. Yeah. A lot of people that come to me, I see probably the most is the very tight thoracic spine.
Hmm.
Can you talk about what the thoracic spine is and then maybe how that would impact overhead pressing or pulling movements in somebody that is lifting?
Absolutely. So the thoracic spine, if you think about like the thorax, you may have heard of that in like bug anatomy. That's that middle part. Same thing for us. It's where all your ribs are. From the base of your neck, you have your thoracic. It starts at T1, moves all the way down to T12 at the bottom of your ribs, right at the top of your belly. That section of your body is the thoracic. And they usually get stiff just because of modern life, to be honest. We sit way more than our ancestors did. We do that in schools even. Like you'd be surprised how stiff kids are these days because of either lack of motion, more time on electronics, more time sitting in school or homework or extracurricular activities. Other than sports, obviously they're going to have them moving,
Yeah.
but more sitting in general. And then as an adult, usually we don't do as much physical labor as previous generations did, where we have to bend and twist and move and swing a hammer and pick things up and lift and move things. Oftentimes, especially in our area, there's a whole lot of people that live at their computer. And so you end up with those rounded shoulders, that upper cross syndrome, they call that, where you get tight in your occipital area at the top of your neck. You get your shoulders tight and rounded, and everything gets super stiff. And then if you're sitting all the time, you disengage your diaphragm, which means you're going to be using all the accessory respiratory muscles of your neck and shoulders way more, and just causes it to get more and more and more stiff. On top of that, our head moves forward. And then what happens there is it's leverage. You picture, you're holding a bowling ball or a kettlebell or whatever in front of you doing a goblet squat or something. The closer you hold it to your body, the easier it is. You
Yeah.
start holding that thing out in front of you, it gets heavy real quick. But that's literally what your head does to your thoracic spine when you have your forward head position shift. Your head's down on your phone, you're typing on your computer for 8 hours, and it just adds a ton of leverage. For every inch, it's another additional 10 pounds of weight on your neck and your thoracic spine. So in that area, you want to be really intentional about making sure that it can actually move because there's no way you can activate all the muscles for your power in an overhead movement or a pull if it doesn't move.
Correct. Yeah. That's why I I tried to do like a 2-to-1 pulling ratio to pushing ratio during the week
Mhm.
just to
Yep.
have that more of a better posture with the back muscles.
I think that's a great idea. And that fits so much with the compensations that we need to do when we're dealing with all of modern life, like I was talking about, because we do everything in front of us and down. So our shoulders are so rounded forward. If you did nothing but chest work and bench all day, or, all the bro stuff that people do, and you don't do working on the posterior chain. Like that's one of the things about strongman is it's so posterior chain heavy that
Yeah.
you need to spend more of that time working on that whole back side of things and overhead extension related things, all of that in general. But especially just for basic modern life, not just strongman training, but like existing in a modern world,
Yeah.
you need to be doing twice as much pull as you are pushing just because of everything we do.
Yeah. I think it was a strong man. He said to be strong, you want to train the muscles that you don't see in the mirror more. When you're standing on standing
Mhm.
straight on onto a mirror, you want to train the muscles that you don't see if you want to be strong. So that would be your
Absolutely.
back muscles, your lower
Hmm.
back, your
Yep.
erectors, your glutes, your hamstrings.
Yep.
That's what you want to train more than the front.
Oh, absolutely. That's so true. And the cool cool thing is he's talking from experience, not from a textbook. But the nature of that is that whole area, well, jokingly, you that's the backbone, right? Should
Yep.
be the backbone of all your training as well. But that's literally the structural integrity of the bones that hold up the rest of your body. Like the spine is a structural engineered thing. If you look at bridges and dams, they're designed as certain shapes for structural integrity, for strength, for performance, for longevity, like a bridge or a dam, like those things. They have their curves, they have triangular geometry all built in. Your backbone or the spine is no different. You have three different independent curves in your neck or your cervical spine, your mid back, your thoracic spine, and then your lower back, your lumbar spine. And the cool thing is when they're in that position, it also functions as a shock absorber, like a spring.
Hmm.
So you can put 800 pounds on your back in the yoke, and your structure can handle that. Maybe your muscles can't handle that, but your structure can handle that kind of weight when it's in good position. When it starts deviating out of that, we start losing our mechanical advantages.
So if someone has a shoulder injury and they, let's say they train uh say 5 times a week and they do, they have the bro split where they do a lot of shoulder and chest and probably
Mhm.
not as much rowing. Could they develop shoulder injuries from doing too much pressing and not enough pulling?
Absolutely. One of the biggest things about the shoulder is looking at it as they call it a shoulder complex. 'Cause it really is complex. There's a lot of crap in there.
Yeah.
But you've got your whole shoulder blade that needs to be able to anchor in order for the rotator cuff to go through its range of motion. You've got your trapezius muscles up at the top, you've got your lats down low, you've got your pecs on the front, your big movers. And when you're training, you want to make sure that those big movers are balanced and strong. What typically happens in the shoulder is you end up losing your position because of an imbalance or weakness or an overtraining of the front is the most common. And then you end up loading your rotator cuff muscles, which are not big muscles. And then they end up straining, tearing, overworking and tightening, which perpetuates more altered biomechanics in a negative way. But usually it's the rotator cuff that's the most common that ends up on the injury side of stuff.
Are there any exercises you like to do for the rotator cuff? Anything with dumbbells or bands?
hmm Honestly, there's a variety of all of those things you can do for the rotator cuff, and to strengthen it is going to globally help most of these issues. A lot of times, the back side of the rotator cuff or the posterior cuff ends up really tight because of that shoulder rounding forward. And then it closes down when we try and go through motions. Our elbows come back, and it really creates a smaller acute angle back there where those little rotators are, your infraspinatus, your teres. So with those guys, they're primarily going to be external rotators, which means you rotate your hand outward. And so you can do that. You can lay on your side, use a dumbbell to rotate outward. You can use a band. You can do it standing or on your side or whatever. And you're just rotating your hand and shoulder outward. So you're opening up your chest, you're squeezing your shoulder blade back, and you're rotating that whole thing backward. That would be the most common. But internal rotation is also very necessary to use and strengthen. And so doing most rotator cuff exercises to strengthen things are going to be beneficial for probably 80-85% of everybody.
Okay.
And they're little bitty muscles, so they really need all the help they can get. But when you get a little bit more stability there, typically you'll be able to then train your other big muscles a little bit more effectively because you don't have those underlying weaknesses that are built out of modern life's biomechanics.
So if someone cannot hit squat depth, is that more of a spine misalignment or is that more of like a hip flexor psoas issue?
Honestly, it depends on the person
Okay.
because it can be either. So in the bottom end of the squat, if your lower back is too arched, That's going to change the mechanics a little bit as compared to having not enough arch or being too straight, or they're more likely to round forward in a back squat or a deadlift. So that rounding forward can completely change your ability to move in certain things. But hip flexors are going to be another big player there too. Typically, if you have a hyper curve in your lower back, your hip flexors are going to be way too tight. So you'll want to stretch them. Any sort of hip flexor, lunge-oriented stretch, the couch stretch is a good one.
I love that one.
Anything that's going to be stretching those guys is typically very helpful for that hyperlordosis, your butt sticks out type of a positioning. And then oftentimes you won't hit squat depth because you're overarching.
Should someone do those stretches before they squat or after they squat or both?
Uh, yes.
Okay.
If that's their issue, then you want to hit it at all sides until that becomes not your issue anymore. And then, there's the philosophies of whether static stretching or dynamic stretching or warm up first and all of that we don't have to get into. But generally speaking, you want to make sure the muscles are warmed up and loosened up before you get into activity for optimal performance there. And then, depending on how hard you go and how much tightness is built by the metabolic fatigue that you create, might recreate a lot of the same exact stiffness that you just opened up an hour or two before. So you benefit from both sides of that. And that's where things like magnesium as a supplement or Epsom salt baths, massage, heat in general, sauna, those types of things are also very helpful to get those muscles to loosen up when you're doing your stretching.
So if someone, you know, has pretty good form on deadlift and squat, they don't really have deal with any chronic spinal issues. Are there any long-term effects of the heavy deadlifts and squats that would
Okay,
that
so are
would
there
be
any
like
health
negative?
risks with that?
Yes,
Yeah, so the one that's going to be more likely to have some risk is going to be the back squat, just due to the physical compression that it adds on the spine. Not that compression is inherently a non-physiologic movement, because we're under gravity all the time. We're made for that. The problem is that compression will typically magnify imbalances. So you've got this little issue, and then it blows up to become a big issue with either compression on the back squat or leverage torque on the deadlift when you lose your position. So either one can and are relatively common to develop, or for probably a better way to explain it would be to not cause an issue, but expose a pre-existing issue. That's probably a better way to think of it.
okay,
Because, like I said, almost everybody already has an imbalance,
yeah.
unless they're strategically working on correcting those things or keeping them maintained. Then you're going to have a weak link in the chain somewhere.
Can lifting belts and bracing techniques prevent misalignment, or do they just mask uh, some underlying issues?
Gotcha. So, breathing and bracing and getting your core tight can be a very protective and healthy thing. So that's going to be one of the biggest, I would say, underrated training components for most lifters.
I agree.
Because if you can brace your core more effectively and you can also breathe while bracing, then you're going to protect yourself from creating misalignments and injury while you're training in a much higher magnitude. And you're going to be able to raise your functional capacity to a much higher ceiling if you can hold everything stable. And then the belts basically just augment that, because you're going to help to have that external rigidity that you can push against harder, that helps to increase your bracing capacity at that top level. Now, if you already have a misalignment, can bracing fix it? Yeah, probably not. But can it help you prevent it from getting worse? In a big way, yeah. It's just going to help all the way around to help prevent issues that you do have from getting worse and prevent you from causing issues while you're training.
So, can you talk about an effective way to brace against the belt? Like some people may not know what that means.
Gotcha. So bracing is one of those things that a lot of people really just don't have a clue how to do. So one visual that I'll explain is kind of like you're filling your whole torso here. Think of it like a drum, like a 55-gallon drum of whatever. Um, it's a big cylinder that you inflate. You pump air in there by taking a deep breath, and then you squeeze it without letting the air out. So you breathe, lock it down. That internal air pressure, like an air tank, is another way to think of it. Like you fill up an air tank before you use that to fill up your tires or use air tools or whatever. That internal pressure is going to push back against the outward structure and create a ton of stability in that whole area. So breathing in a little bit, bracing hard doesn't mean just doing a sit-up, contracting your abs. It's the whole core that you're activating.
Yeah.
So that's going to be your obliques, your erectors, your abdomen, like everything out in that whole section. So breathing in gives a little bit of pressure to push against on the inside. The belt gives something to push against on the outside, and between the two, you can create a tremendous amount of pressure and stability there. Now, the other thing is breathing while you're bracing. So a lot of people end up with trouble because they brace well, but then it sucks the wind out of them. They can't do anything else. They
Yeah.
stop to breathe. They lose their tension. That stability collapses.
Yeah.
So being able to breathe and brace simultaneously is one of the most surprisingly difficult things to do,
Yeah.
but you can train it. Um, another coach was introduced me several years ago to a very simple thing that you can do, 90-90 breathing. You can YouTube the exercise, but basically your hips and your knees are bent both at 90 degrees. You're laying on the ground, your foot's up against the wall. So it's like sitting, but you're horizontal.
Okay.
And so in that positioning, you brace your core and you crunch a little bit. Then you breathe into that and it expands everything. And then as you breathe out, you compress tighter. Hold that tension, force your breathing. And what you're doing is forcing your diaphragm to actually move your lungs more effectively while you're using everything else in your core to brace simultaneously. And it's extremely taxing initially because most people don't breathe with their diaphragm very well and they don't know how to brace well. So then you
Yeah.
do two difficult things simultaneously. It's next to impossible for the average person to do it well. But if you can get them to work independently, you can hold your core tight for longer and still catch your breath. Hugely advantageous.
Yeah. I think you might see somebody that lifts a lot of weight and they're, in their video, they're breathing before they have done the lifting. They're not just doing that to sound obnoxious or anything. They're actually, breathing into their stomach and filling that up with air as much as they can. And then
Yep.
when they feel super tight, that's when they pull. So like I posted a
Yep.
video yesterday of the deadlift and I had like the mic on and you can hear me like I'm pumping air lower into my diaphragm, pushing my stomach against the belt as hard as I can. And then when I feel like I'm about to explode, that's when I do the lift.
Yep.
So it's not like they're not just trying to do that to sound obnoxious or anything. They're actually
Right.
there's a reason they're actually doing that.
Absolutely. Yeah, it's not just hype.
Yeah. Yeah.
Not for Instagram views. There's a purpose behind all of that. You're absolutely right, and that's a great way to connect the dots on that for people.
What's the biggest misconception about chiropractic care in it could be the strength training world or just the regular general population world? What's
Okay.
a big misconception?
Oh man, there's several misconceptions on that one. A lot of times people tend to think they're fine until something hurts, and they don't realize that there's a lot of buildup in really, honestly, most health issues. You look at the biggest health issues that people deal with in America, like heart disease, for example. If you base your heart health on only how you feel, you find out you have a heart problem during the heart attack. What happened to the 40 years building up to that? That we could have done something more about it. But it's the same thing with the health of the spine. That slow build of stiffness, degeneration are things that we typically don't feel until later on. So taking care of yourself looking at your health globally as an investment and an asset as opposed to an expense is going to be a huge mindset flip for a lot of people, but you'll get way more return on your investment the earlier and the better you do that. That's just that's one misconception. You'll hear all kinds of silly things about chiropractic. Um, a lot of that's just kind of misunderstanding of the level of education is one example. For example, it is a doctorate level education, and you can look up the specifics of how many hours and different courses are required, but in many cases, more credit hours are required for a doctorate of chiropractic as compared to a doctorate of medicine. So it's just different specialties, different philosophies, but similar levels of education required. There's standardized exams that are there. Another common one is that chiropractic can be dangerous is another common misconception there. And you can honestly look at the difference in the malpractice costs for a medical doctor versus a chiropractor. Chiropractic malpractice costs are stupid cheap by comparison, like almost nothing. It's like Ferrari, a lawnmower. Like very different levels of expenses. I just lost my There we go. Lost my light for a second. So that's a pretty clue driven by the data that if what you're doing is generally dangerous, your malpractice insurance is going to be really high. If what you're doing is generally pretty safe, it's going to be pretty low. So that's one easy way to understand that one. But it really comes down to an individual actually doing an exam, seeing what's going on, and making some doctor level decisions on, hey, maybe this is a case that does not need to be in here right now. They need to get to their emergency room or something like that. And those kind of things happen all the time, where somebody comes in just because you can actually get into a chiro, whereas other doctors take weeks to get into sometimes. And then they want some help and help me with something now, and they want to be adjusted now. And some docs give in to that, and in some cases, unfortunately, they shouldn't have given in. They should have actually done their due diligence to find an issue that was existing that would have said, "Hey, adjusting that's not a good idea."
Yeah. Are there any chiropractic red flags? Like if you're going to like find a chiropractor, is there anything that should be like,
Like finding a good one.
yeah, finding a good one?
That can be a bit of a challenge depending on really your goals. Like when I look for a chiropractor for somebody in my family or a patient who's moved away, because honestly, a lot of people have moved out of Illinois. Um, finding docs in other areas has been a thing we've had to do a lot of. So typically there's two components that I would look for, ideally first. One is going to be a doc who does more of a corrective care type of approach, where they're going to be looking at the pre and post x-rays to make sure that what they're doing or what they're trying to do is actually effective or not. So you want some objective testing on those things, and an x-ray is really the most effective way to do that for the spine. And then more of a vitalistic philosophy, recognize the body's made to heal itself. We just want to optimize performance and health of the nervous system through that. There's honestly, the other big thing is going to be looking at reviews. You'll be able to find all kinds of info on reviews these days it was not as easy to find those things years ago. But you can look at somebody with 155 star to be pretty good at what they're doing. But from a personal philosophy standpoint, the corrective care and the philosophy of chiropractic for health and performance as kind of the top tier of those things in my mind. And then there's a million other subspecialties that you can get in the chiropractic world where some people just do only a niche population. And so you want to be mindful of that too. Some people only do pediatrics. Some people only do elderly. Some people only do sports, or some people only do auto accidents. Typically, a family chiropractor is going to be able to take on most of those kinds of things.
And that's what you do.
Correct.
That's perfect. Well, that was the last question I had for you there, Josh.
Okay. Did you have anything come to mind as we talked about things and went down some tangents here, as a question for me, while we're on?
What was that you cut out there on that last part?
Any other thing that came to mind that wasn't a question you had thought of previously?
Um, the nerve health. How important is that for someone who is either lifting or just your general person that is looking to improve? How can you improve nerve health? Is that something that you can take a supplement for? Is that something you can help through movement? What kind of things can you do for nerve health?
Honestly, all of those things
Okay.
you can do for nerve health. It's really one of the most important systems of your entire body, because essentially your brain and through your spinal cord and your nerve system perceives all of the input that your external world gives as data for your brain to make decisions about what to do with. And it's the same system that communicates the actions of what to do in response. So your brain literally is wired to your heart, your lungs, your muscles, your skin, and everything. And so it's going to be the prime system that you want to make sure is good and healthy. In training, you also train the nervous system. Most people don't realize that you train your muscles, and you can actually train your bones too. That's another thing most people don't realize. You can build bone density by actually using and loading your bones
Yeah.
via strength training and things like that. But in the same way, building abdominal pressure via bracing and lifting and things like that is a great way to train and stimulate your nervous system, which is the same reason why if you end up with a lot of nervous system fatigue after a heavy lift or after a competition, for some reason over the next week or two, everything feels stupid heavy.
Yeah. Or move super slow.
Right, right. It's that neurologic fatigue. And so you need neurologic recovery. And so neurologic recovery, one of the biggest things from a supplement standpoint, like I said, is that GABA. And then two, the other piece is going to be uh, cholesterol and fats in your diet, which is a big misunderstanding by a lot of people in the that grew up in the low fat era. They tend to be afraid of eating cholesterol and butter and egg yolks and those types of things.
Yeah.
But you know, all of human history, we've had those things and we've survived.
Yeah.
But so the brain and the nerve system is primarily fat and cholesterol. The myelin sheaths that coat all of your neurons is made out of fat. So a lot of that, like your omega-3s, for example, just natural cholesterol and fats are going to be the nutrients that you need for the nerve system itself. Electrolytes are going to be very important, as well as hydration, to be able to have the substances needed for the firing of the neurons. Like you need the electrolytes for that to actually function. So physically, you can train it. Neurologically, you can feed it. And then through motion is another big thing. Like I said, the mechanoreceptive input to the brain via exercise releases endorphins, all those wonderful things for health. And it's that same mentality that chiropractic does an incredible job at optimizing nerve system's function as well, because of the motion that you can regain by adjusting the areas that excuse me, that need more motion, better alignment, all of those things too.
Well, I would like to thank Josh for taking the time out of his busy day to talk about why chiropractic is important for not just people that are lifting, but just your general everyday person. Uh, if you are in the central Illinois area, please be sure to look up Johnson Family Chiropractic Max Living Health Center. He would love to help you out. Is there anything that you would like to say before we end the show?
Honestly, just really appreciate the chance to talk about these things, to be able to support what you're doing is an honor. So I really, really appreciate that.
Yeah, we'll definitely do one in person, and maybe we can uh, go more in depth on certain aspects.
Mhm. Sounds great. Thanks for having me.
Yep.